It's a staggering amount that we're seeing across all of the world in terms of the number of people being diagnosed with dementia. And one of the issues that we have is how to support those carers. So at the moment, much of the services are focused on the person with dementia, and there are less services that are focused on the carers, the informal carers. So those are the spouses, the adult children, the siblings, the adult siblings that pick up the role in being the main carer for someone with dementia.
Do you think people fully grasp what's going to be involved with caring for someone with dementia when they first embark on that journey?
Look, I think it's a huge journey, and no, I don't think people do, and I think each journey is different, and we really advocate to try and support people as early as possible in that journey so that they don't get carers burnout, which is a real problem. Lots of people, they want to do the best by the person, their loved one. Many people, are determined to be that main carer and to have that person at home for as long as utterly possible, which is great. The problem is that caring journey is exhausting, and we need to support those carers in that journey and get that support in place as soon as possible.
What kinds of support do they need, though?
Well, I think in Australia, we've just come through huge changes in the aged care system. And many of your listeners here today will know that it's increasingly complex and increasingly difficult to what we call navigate that healthcare system. And when you're caring for somebody with dementia, you're not only navigating a healthcare system, but you're also navigating a community services system as well. And you need quite a lot of what we call health literacy skills to be able to do that, to be able to find out where those services are, what services you're entitled to, how you access it all is really difficult.
How can video conferencing help with people in remote and regional areas?
Well, the use of video conferencing, what we're doing is testing that we can connect carers who don't easily have access to face-to-face services. So in my previous study, we were using group video conferencing for people with chronic disease, older people with chronic disease. And what that study showed us was that by meeting in a virtual room using a tablet or a desktop computer or a mobile phone, you can connect with people and have a sense of social support, have a sense that the sort of benefits you get from a group face-to-face, we can replicate with using technology.
You're hearing from Dr. Annie Banbury. She is a researcher with CQUniversity and is involved in a project called Caring for Carers, which uses video conferencing to connect primary carers. How long does it take for people to kind of build up the skills via video conferencing that they need? Because for a lot of us, it is new technology.
For sure. And for those listeners that may be not very sure what I mean by video conferencing, it's like a Skype call. So really you go into a virtual room or you go into a room on the computer and other people join you in that room. And it's hard for me to... I want to show a picture, but it looks a bit like the Brady Bunch, when your TV show when you're a kid where you have all these people in boxes, and we only have up to 6 to 8 people, so it's a very, very small group, and they can all chat and see each other in what we call real time, so there's no delay, and it really gives a sense that you're meeting together in a group.
And what's the kinds of things that people are able to get out of doing this with others that are going through a similar journey? Not the same journey, because you said every journey is different with dementia, but similar journeys.
Okay, so I think the biggest thing that people get is empathy, not sympathy. People don't want sympathy. People want to be connected with others who are walking in their shoes. Some people have great social support. Other people have not so great social support. But one thing we can do is by sharing our experiences and what we have learned in that care journey and just talking about the problems or what's worked for us really brings people closer together. So it's that ability to connect with someone and they really understand what you're going through.
You're running these courses at the moment. How long do they take? About 6 weeks, is it?
Yeah, so the program lasts for 6 weeks, but it isn't like a program where you get people together and it's the same people in your group, so you do build a sort of a connection with each other, and then we're supporting groups to carry on meeting by themselves. And the first group that I ran, which was over 6 months ago, they're still meeting by video conferencing. They're meeting on a monthly basis, and they're still continuing to share their experiences and to support each other.
You've been rolling some of these out in Cairns. Are you going to other places around regional Queensland?
Yes, so we've been in Rockhampton, we've been down in Wide Bay. We have participants that come from all over Australia. So we've got people from Rockhampton talking with people in Perth. We've got people as far south as Victoria. So we're very focused, because we're Central Queensland University, we're very focused on Queensland, and we'd love to get more participation from Queensland, but it will connect you with people all over.
People will be thinking, what about the technology? In some parts of the people who probably need it most might have the most unreliable internet.
Yeah, and this is really part of what we mean by a research project, because we're actually testing what sort of technology people need to do this. One of the interesting things with the co-design group, people joined using their own tablets and desktops, and many of them, these were at least 5 years old. So you don't need really new technology, and you don't need great skills, because we can support you in doing all that you need to do to get into that virtual room. It's really simple, but you do need internet connection. We can't get away from that.
So what if people have listened to this and thought, that sounds interesting? Is there anywhere they can go to get more information?
Yeah, certainly. I mean, we would, more information is available from our project officer, and she's here actually in Cairns today. So if I give a phone number, it's 0437 579 695. That's 0437 579 695. And her name is Kristen, and she can tell you more information. Also, people can head over to the Central Queensland University website and look up Caring for the Carers. And there you have all the information that you need and ability to sign up.